I am outside my patient's room, and right with me I have my physician order for the indwelling catheter for my patient here, Cody Taylor. And I also have with me some sterile gloves, an extra set. I'd also bring in extra catheter, but I don't have one on hand, but I would bring that in with me. And I also have my Foley kit right here with me, and I'm going to bring those all into the room. Knock, knock. Hi, I'm Shelby. I'm going to be your nurse today. Before I start with anything, could I start by asking your name? Cody Taylor. Okay, great. All right. And your date of birth? 7/18XX. Great. Both of those match. And do you have any allergies, Miss Taylor? No allergies? Okay, great. Today I'm going to be inserting an indwelling Foley catheter for you. So this is going to help with your urinary retention. So what I'll be doing is I'm going to be inserting the catheter slowly into your bladder, and then the urine that you're producing will then flow through the catheter down into the drainage bag. And all of your urine will then collect in that drainage bag, and then we'll change that out regularly for you. Do you have any questions on the procedure? Any concerns? Not at this time? Okay, great. All right, now that my patient is educated on the procedure, I'm going to go ahead. All right, so I've got some hand hygiene here. All right, and make sure I have adequate lighting. I'm going to provide privacy for my patient, so I'm going to have a curtain here. All right, and I'm going to raise the bed to a good working height, and then put down the rail here. And now that I've done that, I'm going to position my client. I'm going to be putting them in a dorsal recumbent position. So if I could have you flex your knees for me, right on up, right, and have your feet just planted on the bed here. And if you could just relax your legs, your thighs here, and if you could rotate them externally, just like that. Okay, great. If my patient needed help with this, I would have assisted them with it, but they managed okay. I also could have called for help for positioning the client. All right, so now my patient is in the proper position and they're nice and relaxed. I'm then going to drape them appropriately, and I'm going to perform hand hygiene. I'm going to don on some gloves. So I am going to be doing some perineal care. So I'm just going to be using soap and water for this. Okay, so I have some cloths here. Now I'm going to go from front to back. Great. Dispose of that properly, and then I'm just going to dry the area. Okay. All right. Okay, now that I've done that, I'm going to remove my gloves. Got my trash right here. All right, my patient is positioned properly. Some hand hygiene. I am right-sided, so that is why I'm on the right side of the patient. Now that I've done that, I can start with my Foley kit. Now I'm just going to be touching the outer 1 inch of this packaging here, so I don't contaminate the sterile field. Anyway. All right, and then I have my sterile drape. in this too, I can only touch the outer edge of that. And then I ask my patient to lift their hips for me if they're able to, which they are. Okay, great. All right, now that that's settled, I can then don on my sterile gloves. So with these, I don't have the ideal situation as far as my setup here. I don't have the greatest working height. I normally would have that at a more appropriate height. And I have limited desk space, so I'm going to be donning on my gloves in this area right here. However, I know that that really increases the likelihood of contamination on this drape here and also right here. However, in a normal setup, I would make sure that I have a proper area so I will not contaminate any sterile field. Okay, so I'm just going to be touching the outer inch again. Alright. I'm just going to touch the inside of the glove here, which is not sterile. So I can don these on. Just touching the inside here, and I can adjust once I put on the other glove. I'm going to pick up the glove like this. And great. And then I can adjust from here on now that both gloves are sterile. I'm going to keep my hands above my waist, but however my working field is a little lower, so in a normal situation where I'd actually be working with patients, I'd make sure I have a proper working height. All right, now that I've finished with the gloves, I can touch the sterile part of the field and discard it just like that. Okay, all right. Next, I have this drape, which I do not need for my female patient, so I'm just going to dispose of that. I have my trash right here by the patient. I'm then going to move my equipment around on the sterile field. All right, and I see I have all the supplies that I need here. And I'm going to start with the iodine solution. I'm going to open that and then pour it over the cotton balls here. All right, all good. Okay, next with that, I'm going to take this sterile water here, uncap it. All right, and then I'm going to attach it to the catheter here. Just like so, and I'm noting that I have 8.2 cc's of liquid in here. So I'll make sure to chart the correct amount that I insert in the balloon later. Starting this. Alright. And then I have my lubricant here, so I'm going to uncap that. And I'm going to lubricate the tray here. All right, good. Okay, and then I'm going to dip my catheter the first inch to 2 inches in the lubricant. Okay, great. All right, now that that is done, I can then proceed to cleanse the area. So first, I'm going to make sure I have a good positioning on the client so that the urinary meatus is exposed. I've made sure I found this area while I was cleaning the client earlier with the perineal care. So I'm going to start with the outer far labia majoris and start from down bottom. And then I'm going to do the outer near labia major. And then the inner far labium. And then the inner near labium. Going from front to back. And then lastly, right over in the center of the urinary meatus. All right, good. And I don't need my specimen collection at this time, so I'm not even going to mess with that. I'm going to bring my kit over here. All right, so you're gonna feel a slight pressure. Just take some deep breaths for me, okay? Okay, great. All right. Going to wrap my hands around the catheter, and I'm going to slowly insert to about 2 to 3 inches in. Okay, good. I'm seeing some urine here, so I'm going to go about another inch in. Okay, I don't feel any resistance, anything like that, so we are good. I'm then going to keep my right hand stabilized and hold the catheter, and I'm going to take my left hand and inject the balloon. Okay, my patient didn't complain of any pain during that procedure, so I know I made sure I secured it in the bladder and not in the urethra. So there is that. And then doing okay? Alright. Now I can dispose of equipment here. No longer sterile. Okay. Alright, so then I'm going to make sure I have this placed on the side of the bed here in a part that is not movable, and I'm going to make sure that it is below the bladder so the urine can flow properly. I can also use a catheter securement device to attach this to the patient's leg, like a Velcro leg strap, which can help secure that in there. But I would place this on the side below the bladder on a non-movable part. And I can get rid of my gloves. And perform hand hygiene. Okay. And then I'm just going to dry the area here. Very good. Alright, and then I'm going to properly drape the patient back. Is there anything else that you needed? Doing okay? Alright, so then I'm going to do more hand hygiene. I will raise or lower the bed back to to where it was before. And also I'll make sure that the rail is up as well with that. Raise the rail and then have the bed in a good position. So that is all good. Making sure the scene is safe before I head out. My patient is good. They don't have any other concerns or needs at this time. So thank you. And that is my procedure here for the catheter. Now after the procedure, I have a few things I need to document. So first, I'm going to document the date and the time of the procedure. I'd also document that I provided perineal care. I document the size of the catheter that I used, which was a 14 French. And I also document how much of the sterile water I put into the balloon. So I did 8.2 cc's. And then I'd also document how much urine that was initially the urine that came into the bag, so I document that amount as well. And then also the color and the clarity of the urine. If there's any abnormalities, I would document that as well. So those are all the things that I would document. Patient did very good today, and that's all I have. Thank you.